Hey, what's up? How you doing? So today we're at episode 5. We're going to talk about ear lacerations and how to do a running subcuticular wound closure. All right, this first patient of mine, he always laughs, and I laugh when he comes to visit because he's a really nice guy and lives by himself. And he calls and says, "Hey, doc, I fell. I don't feel like going to the emergency room. I just have a little laceration on my ear, and I was wondering if you could close it up." And typically we do that all the time. Anytime somebody has an ear laceration or something small and we can save them from going to the emergency room, we do it. Especially with my elderly population, I try and keep them out of the hospital as much as possible. And just take a look and see what would you call this a small ear laceration. What's up? So today we have a patient of mine, long-term patient of mine. He, dude, what'd you do? You fall? Did you fall?
Yep, I fell.
Okay, so he fell.
I missed a step.
Oh, okay. So we're not gonna hold that against you.
Okay.
So he missed a step and kind of messed his ear up. So we're gonna get him fixed.
I got that corner hard.
You did. There's no question about that. You don't need that. So just hold that right there.
Just as long as you keep me as handsome as I am.
I can't make any promises.
Well, darn.
Remember how we said keep it in the center. Yeah, so dude basically destroyed his ear, and we're not sewing up a laceration. What we're doing is reconstructing his ear. Usually I would do this in the operating room, but because he wanted it done in the office, didn't feel like going to the operating room, I told him we would numb it up. A lot of this is cartilage, so it doesn't numb up that well, but the subcutaneous tissue does. So he should be okay, but it will hurt a little bit, but you know, he just wants to get it done so he can go back home. So that's what we'll do. All right. Man, so I guess the first thing we got to do is figure out how we're going to put this boy back together. Did you take a chunk out of it, or did you just...
Not that I know there's a chunk out. If there was, I didn't find one.
Okay. Let's see what we got. Oh, dude, let me pick up something. Have you numbed him up or not?
Mm-mm.
Okay, I'm just taking a look here.
You feel any of that?
Yeah, okay, so some cartilage exposed. That's got to go there. And then that's got to go... All right, man, I got you. So the tricky part about numbing this up is when you numb up something, you essentially distort the structures. So the swelling can make it hard to reconstruct complex areas. Again, this is ear, so not too many people are really looking in the ear. As long as it looks close to the other side, it'll be okay. Because if you think about it, you see one ear, you see the other, you really can't tell if they match or not. But we're going to do a pretty good job of getting him taken care of and matching. I'm sorry. Little stick. 1, 2, 3. Mm-hmm.
You okay?
I'm still here.
He hadn't run off yet. So he's thinking about it, but...
Them last ones I was now.
Well, if you leave, just leave your ear. We'll get it taken care of and give it back to you.
Well, you
It would be easier.
sticking on with super glue.
I wish, man, but they don't make... Ooh. This is more of a duct tape injury than a super glue issue.
That Gorilla Tape's better.
It is. I like it. All right. We'll stick back here. 1, 2, 3. All right. Can you feel this?
Don't feel much, does
The
it?
first part is
Okay,
sewing up the inner part of the ear. Once we do
let's see what
that,
you
we can
start
then go
doing.
to the outside. This inner part, I'm doing a couple of interrupted chromic stitches. A couple of reasons. One, chromic heals pretty well, and this is a pretty small stitch. Two, I don't have to take them out. So first, we're going to get that inner part to kind of help reapproximate and see what it looks like once we pull the other tissues up. So kind of like eating an elephant, one bite at a time.
Now, if this starts to hurt or anything, just let me know.
I
Okay.
will, don't worry.
Are you on a blood thinner, man? I can't remember. I don't think so.
Just that little old
Aspirin.
aspirin.
Okay, that's fine. Yeah, it's not gonna be too big of a deal. So he's got exposed cartilage in his ear. The cartilage will remodel if we get it close, so we don't have to sit here and match all that up. The nice part about ears, believe it or not, is nobody ever looks at both ears at the same time.
Yeah, I have to turn my right side down.
So if this was your bad side, this might be your good. I mean, this was your good side. It might be your bad side from here on out. But so on stuff like this, especially these jagged edge wounds like it, what you really want to make sure is that you match. Try and match up what was there before with what's there now, from a skin standpoint. A little tender. And how old are you now? 70?
77.
Yeah. So he's got nice 77-year-old skin as well. So it pulls a little bit, but so we have to take a little further bite back than we normally would. How you doing? Okay?
I'm okay.
All right. You might have a little blood in your ear that you'll have to get out, and what you'll do is just put a little peroxide,
Yeah.
half peroxide, half water, not full strength,
Yeah.
and just like soak it in the ear for a little bit. We'll see if we can get some of it out while you're here.
Okay.
So you do me a favor. Slide over and let this table down just a little bit. Thank you.
Can I get it too high?
Yeah, because I mean, well, it was perfect before. Now it's just perfect. That's good. Thank you. And adjust that light from me from over there when you get a chance.
So once we get his antitragus reconnected and we get his antihelix, which is this inner part here, reconnected, then we can kind of start getting to the helix and reconstructing that part. That's going to be the hardest part because we have to kind of pull it up, and you can see he tore it right above the little hump you have in your ear. It's called Darwin's tubercle, but he kind of tore it up above that and pulled it down. So you'll see we kind of are reconstructing this in the front first, and then we'll get to the back to add some support sutures.
That was not a cut.
That's my wife called.
You did not have to see it, did you?
Yeah, she had seen
She
it.
Oh, she did? Okay, all right. I thought you had like a little laceration. Like you had like a little scratch on your ear.
Yeah, well, I tried to tell her just go down and get the Gorilla Tape. She wasn't like,
The problem is, you can just cut the loop. The problem is, I don't think you have that type of Gorilla Tape at your house that we needed. It's a different grade of Gorilla Tape. It's more like King Kong tape.
well, I got some Gorilla Super Glue.
You could have used that, but you know the hard part was getting somebody to hold it together.
Yeah.
You know.
I got to put a clothespin on it.
Yeah, that would have worked.
Now the feeling was coming back.
All right, let's see. You feel that?
I felt that a little
All
bit.
right. Let me have some scissors, Sally, for a second. I'll see what I did. We don't have to. Okay. Grab that light that I said she didn't need. It's over there somewhere.
It's on the seat.
Hold it up just a little bit so we can. All right. Let's see. We got a little off track, but I think we're back on track now.
You don't get lost.
Man, it's a real hole. There's no question about that. So what I did was I basically cut that other one and started a new midpoint. All right, Sally, cut these, that one, yep, cut that one, there. All right. So that's exposed cartilage right there. So this actually needs to come up over. So that's why that wasn't coming together quite like we wanted it to. Let me know if you feel this. I can't remember if we numbed this part up or not. Nope. Okay.
It wasn't that quite that bad, but it was
Listen,
bad.
man, there's no reason for you to sit up here and suffer.
I'm gonna get some more numbing medicine. Thank you.
There we go. All right. Let me get you one little, this is going to hurt a little bit. All right. So usually when you're closing something like this, you might make a centimeter advance, maybe a little smaller. But in him, because of his age and his skin, I can't really take really small bites because the tissue won't hold because it'll rip through. So we're just taking a little bigger, a little further back than we normally would, and taking a little further advance than we normally would. Plus the curve of his ear, you can see almost where pieces are supposed to fit because it wasn't a straight tear. Not that I would say, if you're going to tear something, the ear is a good place to do it, but,
You need more now?
he stopped crying, so I think
I
we're
didn't holler
okay.
yet.
So I think we're okay. Do we still have any peroxide, Sally?
We should have.
Because I may put a little bit in some irrigation in his ear just to kind of get that peroxide out. So you can see it's starting to come together. So the next, so this is, yeah, that's fine. Like 5 cc's of saline, you know.
5 of saline, 5 of.
Yeah. So this is where we have to get creative. Yeah, man, I'm glad you didn't go to the emergency room because, one, they wouldn't have had exactly what we needed to do it. And two, I probably would not have let them sew your ear up, which means I would have been over there messing with them at 10 o'clock at night.
Yeah, I tried to stay away from that place.
Dude, that's the right answer. And then the other thing is that, you know, depending on who it is, some people would have actually done him in the operating room and not at the bedside. Been bad, you know. The downside of doing him he has a little bit of pain, but, you know, I'm not worried about him crying. He's still got to go home to his wife. So
Wait till I get home.
right. The other thing is putting him to sleep for general anesthesia for this is not the best plan. Just save it for a second.
Okay,
Yeah.
for later. Gotcha.
So now we got to start constructing the back part. The main reason I did that stitch there is because that's a transition point in height. So as opposed to starting a new stitch, I can do that. Go up a little bit. Yeah, right there. You forgot to work the camera, didn't you? Yep. It's all right. We'll go through our tutorial again tomorrow. All right. So now what I'm going to do, Sally, I'm ready for that next stitch if you get a chance. And I'll need some more 4x4s.
Now this part on the back, I'm just going to run it. No one sees the back of your ear, so it really just needs to be approximated enough to where it can heal. So I'm not as worried about cosmesis, so this back part goes pretty quick.
And let me have a hand.
No,
Good.
it doesn't stop my ear though.
It did. So you can hear now? Okay.
Yeah.
Let me have a hemostat, Sally. And Sally, hold that for me. Just for a second. All right, this won't take long at all. This is back's not too bad.
That way just a little bit so I can scooch up and look at his feet on the bed.
So you can pull his layer a little more hairy. Ooh, yes.
I heard him.
He can't feel anything.
I can feel her pulling.
Okay, man, you're not helping my cause here. Does it hurt, or can you just feel it pulling a little bit?
Just feeling pulling.
Okay, good. All right, well, I'll take that. All right, a couple more stitches and you'll be done. The easy part about this for you, man, is that you're not going to require these should come out on their own, so we don't have to worry about that. The only other thing I would say is I want you to wash it with soap and water,
Okay.
and you're gonna just cover it with a little gauze and a Band-Aid, and I'm gonna give you a little thing of stuff I want you to spray on it, just to make sure that it kind of helps keep it clean. Okay.
Okay.
So what you do is you'll basically get in the shower, wash it with soap and water like it's regular old face,
Yep.
and then you get out. As soon as you get out, spray that stuff on it. Let it sit there for about 5 minutes. Not 5 minutes, but you let it sit there for a little bit.
Yeah.
And then what you're gonna do is put Neosporin on it, and then that's it.
Okay.
So that it's kind of a wound cleaner, wound water, just to help it heal a little bit better. Keep it from getting infected and stuff. Okay, so I'll relax just a little bit. Hurt a little bit?
Just a little bit, not much.
Okay, all right.
I can stand it.
All right, well, man, you don't have to stand it much longer. We're about done. Over the air knob, but we're not going to hold it against me. There's one, and cut size off. There we go. So let's get that needle. All right, where's that peroxide? So let's just kind of skeet it out the way. All right, a little bit of boiling in your ear. Yep.
I hate that boil.
Yeah, I do too. I just don't want to make sure he doesn't have any. All right, man. Turn your head towards me again. Yeah, good. Let me get that out of there. All right, man. Let's see. That looks good. Turn your head for me back the other way. Just want to look at it. Yeah, that looks.
Strips
No, I think he's actually gonna look. I think that's gonna be fine, just like that. I think it looks.
Get some tape and a gauze for tonight.
Yeah. Yeah. So you're not gonna be able to like cover the exact wound,
Yep.
but what you'll be able to do is cover it with a little bit of Neosporin. Okay.
Okay.
But yeah, I think that looks good. I know it looks better than it did before you came in.
Yeah. Anything to help for that.
All right, man, that's it. Just what we'll do is I will have her set you up an appointment, and then I want to see you in. I want to see you in a week, just to make sure that it's healing right, looking okay, not infected or anything. And let me get you that bottle of stuff to spray on it. And then, like I said, spray the stuff. I mean, get in the shower, soap and water, get out, spray the stuff on it, then put the Laceration, Neosporin, whatever on it, put gauze on it, and then that should be it.
Okay.
Okay? But I'll see you in a week.
Okay.
You need some pain medication, man?
No, I'm good.
Okay. All right. Motrin then.
Okay.
So, yeah, that was not a laceration to the ear. That was a mangled ear. The cartilage should heal up without any problems. The skin, I'm not worried about. The ear has really good blood supply. So because of that good blood supply, usually most people do well without any problems. So it should heal up. But I'll see him back in a week and a half just to make sure that everything looks good. But yeah, he did good. That's it. I did not throw stuff on the floor. It fell. Those are two different things.
You
your mic stopped working halfway through.
That's fine.
We did the garage with ours.
When I go down to let him in, or let him out, you go out there, I gotta step out the door, so he go out. But this morning, he just walked out there and sat down. He wasn't going to go do potty.
Yeah, it's too cold.
So today is Thursday, so you want him to come next Thursday or Monday?
I want him to come next Thursday.
Okay. So that is the 25th.
Yeah, so just come next Thursday.
You'll do like 8:30, 9 o'clock that
That's
morning?
fine. I don't need that much beauty sleep.
Man, your
Yeah,
model,
that's the
your
25th.
model career is still intact, though, man. We got
Yeah, I'm still intact.
yeah, that's good. You
Just
still-
if I turned outside. Thank you.
Just get the
Thank you,
side
Mother.
Dude, my
profile.
pleasure. Like I said, call me if you have any problems, okay?
I will.
All right, be good. Thank you, sir.
Okay.
Yeah, so he's good to go. You know, he kind of came in just as nonchalant with his whole entire ear falling apart as he did with it repaired. Good guy. He'll follow up with us for something else. Hopefully it's not the same ear, maybe the other side. This next patient is pretty interesting. I was doing a thyroidectomy on them, and the student and I were talking about closing. So I figured I'd show a pretty good video of how to do a running subcuticular stitch. This was only like a minute long, but it goes over how to do back and forth, why we do it, how we do it, and what it should look like at the end. This patient has a drain in place going into where we took out their thyroid, so ignore that part. The rest of this is really just about a running subcuticular stitch. All right, so what we're doing is closing this, and Dee was asking about why and how. So essentially what you're doing when you're doing a running subcuticular stitch is you're doing this. So we'll say that's where I'm going to make my stitches. So what I'll do is I have one there. So I'll go in here and come out right here, okay? And then what you do is you pull it, and I'll go across here and come out right here. So you see where I am right there. And then I'll go in right here on that purple and come out at the epidermal junction with that purple. And then I'll come in right here and come out at that purple. So, and then I'll end it at this purple, and I'll come out the tip, which is right here. So essentially what's happening is I have that, and then when I pull it together, pull it out a little bit. So that's what you try to do. So now we're matching those up. Does that make sense? Mm-hmm. And then that ridge, how it's kind of jagged like that, that'll smooth out. So that's pretty much what that did. That's how you do a running subcuticular. All right, that's pretty much it. That's how you reconstruct an ear using chromic stitches, as well as doing a running subcuticular stitch. That clear stitch that I use, that's a 4-0 monocryl, and it's on a cutting type needle that allows us to go in and out without causing a lot of tissue damage. And that drain, just FYI, it'll come out probably in a day or two. That's it. Thanks for tuning in. See you at episode 6.